Hi guys, my name is Chinaza Favor and you're welcome back to my channel. And yeah, in today's video I'll be talking about things you are expected to do in the theater as a theater nursing student. So the first thing you do in the theater when you come as a nursing student is to check the theater. First of all, you change into your scrub because you cannot use your uniform to enter the theater. So you change into your scrub, then after that you wear your cap and your nose mask, then come into the theater working space and clean the theater, like clean the trolley, and the theater, just do a little arrange here and there. Then you check the case. There's a notice board, so you check the notice board. If there is any case today, they always put the case they have for the day on the notice board. So you check how many cases you have that day. Then you wait for the case to start. So when the case starts, what you are going to do throughout the process is to assist. So you assist the anesthetic nurse, you assist the scrub nurse. You'll be able to identify like different instruments that is being used in the theater. So when they say, oh, get this, get mosquito forceps, get artery forceps, you know how to do that, and you know that you do not touch. There are things that are sterile in the theater, so you don't go close to them with your hands without wearing a glove. So you wear a glove to do the sterile procedures, then you get. So another thing you do, you watch the monitor, watch the ECG, and the ECG for the vital signs of the patient. You have the BP there, you have the pulse, the respiration, everything in the ECG. So that's where you monitor the patient. Then you fix drip for the patient. Sometimes we use normal saline. So you ask the anesthetic nurse which drip you are going to fix for the patient. So throughout the procedure, you put drip for the patient. You watch if the drip is finished, you replace and put another drip for the patient. So that's one you do. You assist the patient. You assist the patient to get on the bed. That's the bed over there. You assist the patient to get on the bed. Then when they are done with the operation, you assist in lifting the patient from the bed to the patient's bed, that you take the patient to the ward where the patient came from at first. If it's female ward, you take the patient back to female ward. If it's male ward, you take the patient to male ward. If it's OB ward, you take the patient back to OB ward. So that is what you are going to do. Then you basically assist. That's what you're supposed to do, assist. Then probably when they have a case and you check the patient, if the patient is not shaved down there, you have to shave the patient. The patient nails is long, you have to cut the patient's nails depending on what they ask you to do. So you also have to listen very well. So you listen and know what you're asked to do, or you ask. If maybe something is not done properly or the patient is not shaved, you can ask, ma, should I shave the patient? Or ma, should I do this? You get. And you also pay attention to whatever they are going to be doing in the theater. So that's basically what you do in your 100 level as a theater nursing student. So if there is any other thing that I may not add in this video, I'll probably be writing it down. You get. So that's what you do in the theater. I also have to know basic things, like you also have to know that this is saline, this is Savlon, this is a what forceps is this, different type of instrument. That is what you do. Then you have sterile glove, elbow glove, normal disposable glove. So you know like the difference. You know how to open things in the theater. You want to open something like this, you have to know that when you have to open something, you do not touch what is inside. So you look for where you should open, like here. I don't know if you can see it. And you open like this. And you hand it over without your hand touching what's inside the stuff, you get. So and you also need to know where you are going to dispose your sharp objects. There are different places you dispose things. They have where you dispose your sharp objects, they have where you dispose your other objects. So that's basically what they do in the theater. You do not have to clean after surgery, because we have the health assistants to do that for us. So yeah, it's basically just observe. You have to be observant when you're in the theater. That is just one thing that you are going to do. Yeah, so yeah, we've come to the end of this video. I just want to make this short video to be able to connect with you guys, especially the people that are going to be posted next year to come and work in the theater. So when you watch this video and it's helpful, or you know someone that will be posted or that was posted to the theater and doesn't really know what they are, confused about what they are going to do in the theater, that is what you just basically do. Check vital signs, clean up, assist, make sure you are observant. Check the patient drip during the operation, check how the patient is doing. If basically just assist. So yeah, and pay more attention to and I don't know why, but for me, yeah, I prefer to pay more attention to the anesthetic nurse, because maybe that's where I have my eyes on. You get, but yeah, pay more attention to that. And should, in case they have like any CS operation they're going to do, you know how to receive a child, you know how to receive a newborn, and you know how to take out fluid from the nostrils and the aura. So when a patient comes into the theater, there are things that the patient is asked to bring, or the relative of the patient is asked to bring. So when they bring the carton, it always comes in a carton, like they always put it in a carton. So when you bring their carton, you have to cross-check like the things that they were asked to bring, if they brought it. Also check the patient's PCV, although the anesthetic nurse is the one that always checks it, but me though, I always check the patient's file, like the patient's file, case file, and the PCV. Sometimes when the PCV is low, is either they are asked to go and donate blood so that they will receive blood before the surgery, or they have another option, which is to give maybe some other anesthetics. Probably they ask for blood and you have to bring blood. You should cross-check the blood, like cross-check the code in the blood, and also check if the RH, which is the rhesus factor, correlates with what you are getting. Basically like checking if every details in the blood that they wrote, because they normally write details in the blood, if it correlates with what you are giving to the patient. You don't just you don't just start fixing blood without cross-checking. It may cause harm. So yeah, that's basically it. So yeah, we've come to the end of this video. Please do it to like, subscribe, share. Thank you so much for staying to the end of this video. Yeah, see you in my next video. Bye.